Hello doctors. In this video we are going to learn about Goodpasture syndrome, what happens in Goodpasture syndrome and what are all the clinical findings and laboratory findings. Now, what is Goodpasture syndrome? Goodpasture syndrome is an autoimmune disease that mainly affects our lungs and kidneys. Why only lungs and kidneys gets affected? Because of autoimmunity, our body produces anti-GBM antibodies, which means anti-glomerular basement membrane antibodies. This antibodies mainly target against the type 4 collagen, especially non-collagenous domain of alpha 3 chain of type 4 collagen. And these collagens are mainly present in our lungs and kidneys, so our lungs and kidneys get affected. So, their main target is pulmonary capillaries and glomerular basement membrane. Now, is there any risk factors? Yes. Any respiratory infections, especially viral infections, and any drug exposure or toxic lung exposure may lead to GPS. And as we already know, it affects lungs and our kidneys. So, what happens in lungs and our kidneys? Mainly, bleeding occurs. In lungs, hemoptysis, and in kidneys, hematuria. So, this is the major finding, hemoptysis and hematuria. Along with this hematuria and hemoptysis, there are some other manifestations also. Especially in our lungs, because of the inflammation and alveolar damage, they will develop dyspnea. And similarly, in kidneys, because of GBM damage, they will develop hematuria. Also, the features of glomerulonephritis will be there. So, the patient may have hematuria, proteinuria, edema, and they may develop rapidly progressive renal failure also. And we might be knowing this thing. What is the special feature of glomerulonephritis? RBC cast. So they might be having RBC cast in their urine also. So that will suggest glomerulonephritis. And this GPS comes under ANCA negative vasculitis. Now here comes the triad. What forms the triad? Lung manifestation, kidney manifestation, and anti-GBM antibodies. They are the triad. I repeat. The triad of GPS is glomerulonephritis, pulmonary hemorrhage, and anti-GBM antibodies. This anti-GBM antibody is especially IgG antibody. So finally, when we will think of GPS? Hemoptysis with hematuria, and the patient is having anti-GBM antibodies also, especially IgG. And if they are smokers, this is more common. So men are most commonly affected than females. Also the past history of preceding infection. So this is about GPS. Thank you so much. Happy learning.